Hello everyone, my name is Kent, and today I am going to show you how to sign up for health insurance through the exchanges mandated by the recent passage of the Affordable Care Act. Today is Saturday, November 23rd, 2013, and cut. Hi everyone, my name is Kent Green, and today I am going to be showing you how to sign up for health insurance through the exchanges recently set up by the passage of the Affordable Care Act. I am recording this on November 23rd, 2013, and I just looked up to see that the federal government extended the time in which you could enroll for coverage starting January 1st until as late as December 23rd currently. So we have 1 month to figure this out, as it were. It is a little bit complicated and confusing, but hopefully after watching this video, it will be a little bit more simple. Now, I am an Oregon resident, and so most people I know who are looking for this information are interested in Oregon's website. But I'm going to briefly, for the beginning, show anyone how they can look, where they can go to get information on their state. I'm not going to go into detail on all 50 states because that would take a really long time. Now, by a funny coincidence, if any of you are fans of the British sci-fi show Doctor Who, today's Google Doodle is in honor of Doctor Who, which I'm amused by. But I just thought I'd point out what this is. 50th anniversary of Doctor Who. Okay, back to business. So we're going to go to healthcare.gov. We could just go directly, but, we're Googling it. Oh, one more thing. The application itself is only compatible right now with Internet Explorer, which is why I'm using Internet Explorer. Normally I prefer Chrome or Firefox, but you will have to use Internet Explorer for this. So we're going to healthcare.gov. Alright. Now there's a lot of information on this page which you can either pause the video and read, or you can read on your own. But I'm just going to go right here to apply online. And we're going to go to choose your state. Now you can scroll to see all these different states. Some of them, like, Iowa, uses the healthcare.gov site to apply, while others, like Oregon, have their own distinct site. And you can actually, in the case of Cover Oregon and probably the other states that have their own site, you can probably go there directly. But we're just gonna do that through this. So here we go. Cover Oregon. Now we're going to go to, the first thing we're going to do is we're going to go to Explore Coverage just to get a ballpark idea of what is actually available on these exchanges. So we're going to Medical. And we're going to browse plans for individuals and families. Okay, let's see. There we go. By the way, as a disclaimer, I am using as little of my actual information for this process as is reasonably possible so that I don't have to worry about identity theft. That's just a little disclosure here. What is your county? Now, of course, because of the scope of all this information, I'm not going to be able to... The numbers I come up with here, I'm not going to be able to tell you whether or not you'll get numbers that are similar. I suggest to you take the opportunity to look it up using your own accurate information to see what's available, rather than reading news reports and opinions of people saying, oh, I have this health insurance and it's so expensive, or I have this insurance and it's such a great deal, or this kind of thing, because it really is, it depends a lot on your situation, financial and otherwise. Member of a tribe, no. Total number, okay. We're going to say 3, and we're going to say 60 grand income. I wish. Oh, did I say that out loud? Sorry. Okay, so we're going to say 32. No. And person. And 30. No. And we're going to say, I don't know, a 3-year-old. Better not say yes for that, otherwise, bad. Alright. Welcome back. Sorry for the jump cut there. The screen froze briefly. It was probably my fault. I was trying to open another tab to look something else up real quick. And I adjusted my numbers to make it easier for this demonstration. I switched it to a family of 1 making 25,000 adjusted gross income per year. So this is the page you get as soon as when you give the estimates. And this is the calculation for the tax credit. This is the amount you are expected to get per year, and this is the amount you're expected to get per month to help you with your premiums. Down here, this just shows how it's calculated to give you this per month amount, but these numbers are always the same because it's just a static example, so don't look at this dollar amount when you go on the site and be like, oh, this means it's a huge amount, or it's too small, or whatever, because that's just to show how it works. Anyways, so we can choose up to one of 72 different plans. Now, I'm not going to go into all the details of each of these different plans, because that is ridiculous to discuss, but I'm going to show some key things that will make your search a little easier, a little simpler. Now, you can pick how many you want to display per page here. 10 per page sounds pretty good. And then you can select your method for sorting it. So lower quality, that's these star ratings, or low to high quality, high to low quality, price low to high, that's pretty obvious. That's just this amount after the tax credit, high to low. So we can take a look at different ones of this low to high, and as soon as we select an option, it gives us an update. Now this is something I hadn't noticed before, but plan levels are rated based on these gold and silver and this kind of thing. Although there's a lot of information you need to actually look at the details. The devil's in the details, as they say. Now, since I've already done some beginning research on this, I found that based on what I'm looking for, the only good deals that I consider to be really good deals have been in the silver section. This kind of thing. Now, to give a little disclosure as far as what I consider a good deal as far as health insurance, I'm willing to pay a higher monthly premium if it exposes me to less risk in the form of high deductibles and high out-of-pocket maximums. Because my logic is, when it comes to health insurance, most of the time I'll probably be healthy, but that one time when I get in like a car accident or, catch, the rarest strain of antibiotic resistant bubonic plague, which I don't even know if bubonic plague is a bacteria or this kind of thing. I want to know that I'm not going to pay out the nose all at once. I'd rather pay a bit more up front. But how you choose your insurance priorities is up to you. I'm just giving some general information on how to show. Now, an obnoxious thing is it wants to update every time I click any of these options, and there's more options we can go through: insurance company, plan type, all this stuff. But you can mess with that on your own, depending on what kinds of selections you want to go for. Now let's see, we're going to go quality rating high to low. And again, quality rating are these stars here. Now I've already said I want a lower deductible and out-of-pocket maximum. So let's see, and I really like Kaiser. So the best one from my perspective is probably going to be, and it's important, like even if you know which provider you want, it's important that you actually compare them. So there's only 3 from Kaiser, so we can compare all of these side by side. And here's how we do it. We select the ones we want to compare side by side. And of course I could select some. Okay, apparently when you select 3, it just takes you straight there. Oh, because it only has room for 3. Now we could have selected one from a different provider, but since all of these are Kaiser, Silver, this kind of thing, it's a good standard for seeing how there can be some variance, even from the same provider, even for the same quote-unquote quality of care. You can see that one of these plans has a higher premium than the others. This is the amount you pay after your tax credit. This kind of thing. And you get a quality rating, stars, and this kind of thing. Here is the deductible and out-of-pocket maximums, which are the things that I'm most concerned about. You can see that this one is lower, but there's a little M here. So somewhere down here, we're going to find out what that little M means. Or maybe it's at the top. Here we go. Indicates a combined EHB medical and drug deductible. I'm not 100% sure what that means in this context. I would assume that it means that both the direct medical costs and your drug expenditures count towards the deductible, but I'm not sure. If this is something that you want to verify, then I suggest it's a good thing to look up. Now here we go. Here's some some things to look for that can be different. So for the most expensive plan, which I think it said was $206, something like that, a primary care visit is $30 per visit. The slightly cheaper monthly premium has a $35 per visit, but the one with that's the same price, the same premium as the cheaper one, but with a lower deductible and lower out-of-pocket max, significantly lower, instead of being a flat amount, is 20% of the cost of the care visit. So a lot of this can be confusing, and that's one of the frustrating things about health insurance. On the plus side, at least you're looking at this stuff side by side. And if you have health insurance through another source, it's a good idea to look at that information and compare it side by side to make sure you know what you're actually doing, what you're actually comparing. This kind of thing. Of course, a very difficult thing to compare is when you're comparing different providers, because of course with different providers it's not necessarily cost that's the only difference. This is an easy way to compare different costs, but it would be more challenging to compare, like, is my 20% of Kaiser's Care, how does that compare to 20% of Providence's Care? Because, this kind of thing. Unfortunately, it's part of the complexity. So we can see there's a lot of different things. Prenatal care is no charge under this plan. It's 30% under this plan, no charge under that. A lot of the percentages and this kind of thing. And of course, again, it bears repeating over and over again that these estimates, these costs, and these kind of things, they vary massively based on your situation. Even changing your situation slightly can change how these things are calculated. So you want to make sure you actually look for yourself, just to be informed. Alright, I think we've gone into enough detail about that. Now, in order to actually get a particular plan, though, you have to fill out the application first, because you have to give them the actual information and this kind of thing. So we're going to look at the actual application first. So we're going to click here to go back to the home page. And then we're going to go to Apply Now, fill out an application, and we're going to go to Submit Online. And this is why we're using Internet Explorer again. We can only do that through Internet Explorer. Okay, so these are various info and disclaimers. The gist of it is you have to use Internet Explorer. You can't save your application, and it will automatically close after an hour. You only have 1 hour to complete the application. Be prepared before you start. Since this will involve things like tax information, income estimates, all kinds of that stuff, I think the best way to approach it, the way I've chosen to approach it, is to print out or just download a copy of the application separately, fill it out, so you have all the information figured out in the way you need it for the application, and then come and fill it out online. You can also mail or fax it, but if you submit it online, then as soon as it's finished sending, it's in their system, it's being processed. So I find that it would be preferable to do it online because it gets there instantly. Even if you fax it, it should get there fast, but then it's like, did it go through? And, someone has to enter it manually, and there's more likely there's going to be mistakes, and yeah. There we go. So this just tells you different information. If you want to read this, feel free to pause. I'm just going to keep going. Alright. Now there's two options for applications. To apply for health insurance and financial savings, including the Oregon Health Plan. So this is where you want to click if you want to see if you qualify for essentially discounted premiums. Now, we already looked it up, but that was just an information tool that took general information, this kind of thing. This is the application that it's actually going to be based on. Now, if you just want to apply directly for private health insurance, then you can click the second link. I don't see a reason why not to click to this first link. Because, the worst they're going to say is like, oh, you're too wealthy, even though probably you're not, but you're too wealthy by our math, so, you can still apply it. It won't hurt, right? I mean, sometimes they might be like, oh, you only get $5 off a month your premium, but I'm like, I'll take $5 off, that's $60 a year, or it could help out a lot more. It depends on your situation.